Hello and welcome to VITA Services for West Michigan's portion of the Affordable Care Act training. Today we're going to cover some very basic information about the Affordable Care Act. This is Amanda Grover with Goodwill Industries of West Michigan, and I'm the Tax Program Coordinator. Today we're going to cover just some of the very basic information about the Affordable Care Act. I'm going to show you what it looks like in the tax software a little bit, but I'll be completely honest, there isn't a ton of training material still available for the Affordable Care Act. A lot of what people see at our VITA sites is very basic and very simple, so I don't want people to stress out too much about this portion of the tax preparation. I know it's been very confusing for a lot of people to get enrolled in healthcare, and there's been some issues with getting enrolled, but that really doesn't impact us as tax preparers. What I like to remind tax preparers of is that we are not people that are doing any sort of healthcare enrollment. We don't have to be experts on healthcare enrollment. All we have to do is understand the tax forms are provided and understand how it works within our tax software. So with that, I'm going to go ahead and jump into the TaxWise system as well as our PowerPoint presentation. So I'm going to be jumping back and forth a little bit to try to give you an idea as to what it's going to look like when you're with a client and you're filling out the software, you're filling out this information in the software. But I am going to stay mostly focused on just the PowerPoint presentation to cover the basic information so that we don't get too lost and too ahead of ourselves. So I'm going to jump in. First, the question that a lot of people will ask me, whether they're trading to do taxes or whether they're at the tax site. And they ask me, does everyone really have to have health care coverage? And it's true, yes, everyone does have to have some sort of form of health care coverage. As of January 1st of 2014, people began receiving penalties if they did not have some form of health care coverage. So this doesn't necessarily mean that a ton of things changed for a lot of people. There's still people that are covered with Medicaid and with their employer's health care coverage. But it does mean that people that were falling through the cracks that didn't have any healthcare coverage would now be penalized for not having it. Last year, the penalty was at the maximum I saw, I believe, was around $95. However, this coming tax season, the penalties are going to be becoming much more steep. So last year was a really good opportunity for us to talk to our clients that were coming in. If they didn't have any healthcare coverage, they did receive a penalty, and we were able to refer them to a place in their local area where they could become enrolled in healthcare. So hopefully this year it's not much as big of a surprise. Last year we did still have some people that really didn't understand. I don't know if it's because it was kind of an intimidating process, but for whatever reason they really didn't understand the fact that they had to have the healthcare coverage. So healthcare coverage is required of everyone as of right now. This is a little chart. This is how I like to break everything down. For people that are first learning about the Affordable Care Act, and because of their previous information they were provided, it can be kind of intimidating. So I like to really break it down for people. There's three different situations a person can be in. They can have minimal essential coverage, they can have an exemption, or they can have bought insurance through the marketplace. Sometimes people do have a mix of these three things, but at any one point, people are only going to fall into one of these three situations. So if you break the year down by month, people may have a couple of months where they had minimal essential coverage. They may have a couple of months where they had an exemption, and then they may have had to buy things from the marketplace. However, if you keep in mind that someone's situation is only going to fall at any one time into one of these three categories, it helps to keep some of these ideas straight. So there's minimal essential coverage, there are exemptions, and there's the marketplace insurance that we're going to talk about today. Also, some of the information that's associated, so there has to be documentation if somebody has an exemption all year. They may have received a government-issued exemption certification number. If we have that certificate number, then we can just put that into the software. If somebody bought insurance through the marketplace, we absolutely have to have the 1095A form. So that's what these things are referencing down here. Again, as we get started and jump into this information, I first just want to start with what these three situations are that somebody could be in regarding insurance. So first we're going to start with the easiest, and luckily the easiest, which is learning about the minimal essential coverage, luckily that covers about 90% of what I saw at our tax sites. So for the most part, what you're going to be coming across is going to be very easy, and it's going to be very simple when we're talking about our tax returns at the VITA sites. So it's either called full healthcare coverage sometimes it's called minimal essential coverage. It's basically having some form of healthcare coverage. So it can be sponsored by the employer. A lot of people receive that through their employer. It can be Medicaid, Medicare, any sort of insurance somebody has as a result of their retirement or pension. COBRA is another huge one. As long as somebody had some form of healthcare coverage throughout the tax season, we just indicate that. So to show you what that looks like in the tax software real quick before we jump into some more information, you'll see on this on the 1040 we're in the TaxWise software. I'm using the Eugene Autry example because he had some wages, and we're going to play around with this tax return a little bit so I can show you what the ACA worksheet does and what it looks like. So if it's just Eugene in the house or if there were dependents and they indicate that their employer covered healthcare all year, we just mark this box full. And you just do so if there were dependents. You just check those boxes. And that indicates that there was healthcare coverage for the person and that they were covered all year. You'll see over here on page 2 of the 1040, it also shows up down here under this checkbox where it indicates that there was full health care coverage. And that's it. And like I said, for a lot of our clients coming in, those 5 items covered on this page right here, this covers about 90% of the clients that we see at our tax sites. So just know that that's going to be, for the most part, all you'll have to do. However, I do want to prepare you and do want to train you for some of the other things. First, we're going to finish covering minimal essential coverage. So minimal essential coverage, one way that you'll know, you can ask the client. A lot of the time they'll be very aware if they have healthcare coverage through their employer. It may also be indicated on their W-2 form. If they have something in box 12, it's usually because they have contributed to some sort of healthcare plan. So there's individual healthcare that may be purchased through a college, for example. So sometimes there's student plans if somebody enters college. But they also may buy it through the marketplace, and we'll get into the marketplace in a few moments. But there's different plans that somebody can purchase. So say they didn't want to go to the marketplace, they can still go to some place like Priority Health or Blue Cross and buy healthcare coverage directly from that provider. So that also may be the situation with people that are retired. They may have had, as part of their retirement pension, something established with a healthcare provider previous to their retirement. There's government-sponsored healthcare, so that still definitely counts as minimal essential coverage. So there's Medicaid, Medicare, there's TRICARE, there's there's VA benefits and different coverage for veterans. So all of that counts as minimal essential coverage. There's a few other forms of coverage out there. We didn't run into it at any of our tax sites, so I'm not going to spend too much time on that. But just know if the client comes in and they indicate that they had healthcare coverage, all we have to do is select that box right over here that there was full healthcare coverage, and that's all we have to do. Okay, so this just talks about what I just showed you on the Autry return. It's going to show up here on line 61. If there is anything, any sort of a cost with the healthcare plan for an individual that we're preparing their tax return, it's going to show up on line 61 under other taxes. So that's minimal essential coverage. Now we're going to jump into exemptions. So what is an exemption and concerns to the Affordable Care Act, and what is this going to look like? So there's times when if somebody didn't have a form of healthcare coverage, so if they didn't have minimal essential coverage, it may be because there was a job change, it may be because of a lot of different things, but a person may be exempt from being charged or penalized for not having insurance for various reasons. Sometimes, depending on income, If a person goes to apply for insurance, but they don't make enough money where it's affordable, but they make too much money where they're over income for something that's government sponsored like Medicaid, they may fall into the cracks and they may be qualified for what's called an exemption. So they may receive a form from the government, and this is only if they have applied for healthcare coverage and have been told that they are over income. If that's the case, the government will send them an exemption form with a certification number. And that's where we can talk about exemptions. There's also short-term exemptions where somebody may be exempt from a penalty for several months. So this is an example of some of the hardships that came up last year. There is going to be a full updated list. I don't want to give you, I can provide you last year's information, but the list has not been updated since last year, and I think that that's going to change. So but there's different situations where exemptions um, can can be relevant. So this is the form that you have to complete. It's 8965. If somebody's exempt for a few months, you just go under this line, and we'll jump into the software because it's a little bit easier. So we're going to use the Eugene Autry example. Let's say that Eugene received a certification number from the government um, because he was exempt from the healthcare coverage all year. Let's say his income made it so that he was in a situation where he was over income for any sort of Medicaid, but he couldn't afford the insurance out of pocket. With this example, his income obviously does not make that very realistic, but we're just using this as a worksheet to work off of. So you would indicate that there's some sort of exemption, and then this form 8965 is going to highlight. Over here, if Eugene received a certificate number because he was exempt all year, you would just type in his name, the social security number, and that certificate number, and that's all you would do. So it would be Eugene Autry. We would use his social security number and then the certificate number. I think it's usually 6 digits. I could be wrong and they may change that, but it looks like it's 7 digits right now. So that's all you would do. And then it'll show that he is exempt from healthcare coverage. So it'll say, are you claiming this exemption because your household income is below the filing threshold? Obviously with this income it's not, but we're going to say it is. And then we're claiming that exemption because the gross income is below the filing threshold, and we'll indicate yes. And then that's it. And then Eugene does not have any sort of penalty for not having health care. You'll see that there. So that's how that works. If he were only exempt for a couple of months, say he had retired, he had been covered under his employer under Walmart's healthcare coverage from January through April, but his Medicare wasn't going to start until August. If that were the case, you would, in this 1040 box, you would go ahead and keep this exemption checked, but then you would go down to this 8965 form that would populate, and we're going to remove this information and pretend like this never existed. So if he just needed healthcare coverage for a few months, he could claim there's usually a short-term gap coverage. You would just check the months that he didn't have a coverage. There's an exemption code that'll be updated in your 4012, and then you'll just type the client's name. So we're trying to use the different codes in our 4012 to try to make someone exempt. You can use a number of codes for one person and put the information in to this form 8965. So we're just going to go through. And so let's just say he had 2 months where he wasn't covered. This is what you would do for that. And then he's not left liable for any sort of penalty for those 2 months. If he were, So if he didn't have health care coverage for those 2 months, then what you would do is you'd go to your 1040 ACA worksheet and you would indicate that there's a penalty for those 2 months. So if there was not an exemption that he could use, then he's penalized for 2 months. If somebody is going through and they don't have any health care coverage all year, this form is to calculate a health care coverage fee penalty. And so you would just check all of the boxes. And that will calculate over here on page 2, line 61, the penalty. So if he, based on his income, because he didn't have any sort of health care coverage, he would have had to pay last year $368. And again, keep in mind that those amounts are only going to go up. So let's jump back over to some of our information, make sure we're not forgetting anything. I just showed you this 8965 form in the tax software and how that works. Again, we're going to try to use any certificate number. So if somebody comes in and identifies that they have a certificate, but they might not have it with them, we'll definitely want to wait to prepare their taxes, because that certificate number, it can get them out of a huge penalty. So we want to make sure that we're doing the best we can for our clients and that we're getting them the maximum refund. If somebody's hit with this healthcare penalty, then that's obviously going to reduce the return that they're getting. So what if somebody, let's talk about the marketplace. So let's say somebody doesn't have access to employer care coverage. They don't have access to the government sponsored insurance. What are they supposed to do? Like I said, they can either buy it out of pocket and go to a private insurance company, and then they'll have minimal essential coverage, or they can go to the marketplace. The marketplace is created for people to buy healthcare coverage, and based on their income, they'll receive what's called a premium tax credit. And what that does is it advances money to the insurance company so that when the client is paying their monthly premium for insurance, it's lowered based on their income. So I know that was a little bit confusing, but basically what the premium tax credit does is it provides coverage, it provides a credit for people, but the credit goes directly to the insurance company. And then the insurance company then lowers the insurance premium that they charge monthly to the taxpayer. So if somebody does buy marketplace insurance, we absolutely have to have this 1095A form. There's no way around that, unfortunately. But this year will hopefully be a little bit easier. I think people are going to be a little more used to seeing this form and using this form. So I think they'll come in much more prepared. This is the section on the form that's going to be filled out and that we need to look at for our tax software. And we basically just enter the information from this 1095A form directly into the software. So it's really not that difficult once you get a couple of them under your belt and you understand how the form is set up. So there's, you can see here, I know it's kind of small, but you can see on the form there's columns A, B, and C. We're going to go ahead and this is what it looks like in the software, but I'll give you an idea of what it looks like over in our Gene Autry example. So for Eugene Autry, we've got our 1040 form, the ACA form. Let's say that there is full health, that there's coverage for the client all year, but through the marketplace. What we do is we indicate that there's just marketplace coverage. And then we indicate that there was full coverage in the marketplace. This 8965 form goes away because there's no exemption, but this 8962 form highlights. The first part of the form, we're just going to indicate that Eugene Autry lived in the lower 48 states. We're going to indicate that it's going to ask some questions just about the premium tax credit. So the first question that it asks, and again, the software will prompt you to answer it by highlighting it red, is it asks, did you share a policy with another taxpayer or get married during the year? If somebody got married during the year and they had healthcare coverage bought through the marketplace. That unfortunately is out of the scope of VITA, so we would have to mark no, and it just so happens that with this example with Eugene Autry, he did not get married through the year. So we're going to indicate that no, he didn't get married. And then it asks, do all forms of the 1095-A for your tax household include coverage for January through December with no changes in the monthly amount shown on lines 21 through 32? We're going to indicate no. So we can have the annual cost that we can enter here, but what you'll want to do is just enter everything directly from that 1095-A form that you were provided. You can see here in our tax software, it says that column A matches with column A on the 1095-A, and on the 1095-A, column B and column B match up. But what it doesn't indicate is that the column C on the form is actually column F for us in the tax software. The software will calculate all of these other amounts. So let's go back to the example that I just showed you. So the 1095-A, these are the columns that I just showed you in the Autry example. And then let's use these figures. So let's put in for A that it was $300 a month for the monthly premium amount, and then for the monthly premium amount for the actual cost of the healthcare, let's say it was $334 for Eugene. So usually these amounts are the same for each month, although they might change a little bit. And that's just based on what the client, what their circumstances is. So sometimes there might be a change in job or something like that. So for each month that there was healthcare coverage, we're just going to, through the marketplace, we're just going to fill this in. It can be a little bit tedious, but it's a necessary evil. Again, you don't see a whole lot of these, but it is good to be very familiar with them when they come in. And you can see the software starting to calculate the information too. And then our column C, that is not filled out. Let's go check that. They had 142 over here, so that's what we'll go ahead and put on our software too. So if this were really our example, we could see that Eugene Autry received too much of a premium tax credit based on his income. So he would actually have to pay back $530. Well, let's see, over here, $1,704. So he would have to pay back the excess amount that he received. A lot of the time that'll happen if somebody received too much of a premium tax credit because they indicate that they may have 5 children in the home, but there's been a change in the housing and there might only be 2 children in the home or something like that. So it's important that people update the marketplace whenever a job situation changes or a family situation changes. But this just gives you an example of how to fill out the form. So again, this form that we just entered into the software goes and matches the example right here. So that's the marketplace coverage for the marketplace. Again, like I said, the column A and column B match up, but column C on the form is actually column F in the software. So that's the big thing that you'll have to remember. Down here, it shows that advance of the premium tax credit. And then over here, it's going to show any sort of excess that was received. And again, on line 69, it'll show if the net premium tax credit. So this may be a negative number, this may be a positive number. Just make sure that you're entering what's on the 1095A properly, and you should be fine. Sometimes people who have to pay, if it looks really off to them, they may want to contact the marketplace and make sure that they got the correct form. If somebody owes money, again, the software will calculate everything based on the information we put in. So we just have to know where to input the information. As always, if somebody has any questions about that shared responsibility payment, they can go ahead and ask the marketplace, or they have the option to not file the tax return if they're really concerned that what has been prepared for them is incorrect. So again, if somebody has no healthcare coverage, you just indicate that with all of the different checks on the boxes. This form is really to calculate, this ACA worksheet is really to calculate any sort of penalty. So if somebody didn't have any healthcare coverage, you do have to indicate and check that they're penalized for all months of that year. So that's the ACA in a nutshell. I know this is a little bit confusing. We'll definitely work on the different situations that come in together. Make sure you use your 1040. Don't be in a huge rush as you get started on working with the Affordable Care Act. Make sure to use some of the practice scenarios in the 4491W. And note that you make sure you don't rush through anything. Work very slowly through these. Ask questions as they come up. Notice how much work that the software does for you. You just have to know how to enter it. So hang in there. Don't get too frustrated with it. I'm always here for questions, and please let us know if there's anything you need with this information for any sort of clarification or within the software. Thanks for joining me, and have a great day.